Exercise-induced asthma. You can find a lot of different numbers for these things. So here we talk about it affects anywhere from 12 to 50% of the population. 90% of the asthmatics, have exercise-induced asthma, whether they know it or not. And again, 35 to 45% of people with allergic rhinitis. Okay? And when you said they exclude those with rhinitis and allergic asthma, 3 to 10% of the population probably has exercise-induced asthma. Okay. And then it says it seems to be more prevalent in the winter and cold months, especially with winter sports. And again, numbers that you can throw around. They say it's high 35, 50%. Figure skaters, ice hockey players, skiers, and competitive. Okay. So, and a lot of this stuff is not going to be earth-shattering, but I'm sure you know. Cough, shortness of breath, chest pain, tightness, wheezing, problems during exercise suggest exercise-induced asthma. Okay? We're going to go over a lot of other some differential diagnoses near the end, but this is kind of what you're looking for. And basic simple thing, exercise challenge test can be used to establish diagnosis. What we look for is a 15% decrease in peak expiratory flow, or FEV1, and it's compatible with exercise-induced asthma. Okay? As you see here, I just wanted to throw this up because you'll see this occasionally in the literature, exercise-induced bronchoconstriction versus exercise-induced asthma. What's the difference? The basic difference is exercise-induced asthma is problems with exercise in somebody who already has asthma. Exercise bronchoconstriction is somebody who's not officially diagnosed with asthma. Right? So again, these are the terms that describe reduction in lung function. And the classic 6 to 8 minutes, when you said 5 to 10 minutes after vigorous exercise. It occurs 5 to 10 minutes after vigorous exercise, usually defined by a quantitatively 10% fall. Again, more numbers, 10% fall in FEV1 on the standardized test. 12 to 15% is what the term we usually use. If I get 10%, that's close enough for me. And again, terms are used interchangeably, but again, EIA is for people who already have asthma. Look at that. All right. So it took me 3 hours to do that. All right. So again, most common cause of chest pain, cough, wheezing, shortness, tightness of breath, and exercise in children. Okay? It's funny, some of the kids don't even know they have this kind of stuff. And this is what I kind of got to get to at the end. A lot of kids don't know they have this, so they don't exercise because it happens. So, they kind of just put it aside. In this day and age, it's so much easier to play a video game. You don't have to get all worked up. And what are we worried about? What's the biggest thing going on in the world now? Childhood obesity, absolutely. So get them on the rumps. You got to get them out playing. So this is kind of thing you got to keep your eye out for. And exercise might be the only precipitant of asthma in some patients. Again, diagnosed by maximum expiratory flow rate decrease. Ideal provocation is, as we said, exercise 6 to 8 minutes with peak heart rate of 170. And it's commonly seen in high school athletes. We do exercise challenge tests called pulmonary stress tests in our office. It's kind of the poor man's way. They do it as if they did it in one of the pulmonary function labs. What's nice about it is we're able to kind of come up with a lot of information. It's really tough. Some of these kids, it's really difficult. It's really difficult sometimes to make this diagnosis in some of these high school kids. We see some high school kids, swimmers, cross-country runners. It's really, we can't even get them up to 170 beats per minute. I mean, we put them up, we're inclining them, we got them running like crazy, not even sweating hard. I don't think those kids have exercise-induced asthma. There's a level, there's a ceiling for some of these guys. And it's, they get to a certain ceiling, and that's about as far as they can go. I mean, strength, and some of these kids are going to get stronger as they mature a little bit more. We see this a lot, and I mean, sometimes, we've got them going straight up the wall, and they're not even breathing heavy. I said, I don't think you have really problems. I don't think you need any medication. But they all like it better, so it's cool. Okay. Provisional diagnosis, which we do we do this all the time. Provisional diagnosis of exercise-induced bronchospasm has to be made. The person complains of breathlessness with activity. Again, shortness of breath is towards 5 to 10 minutes after ceasing exercise, and the breathlessness experienced during exercise. And this is kind of what I really look at lately. Is there's the early phase and a late phase. So what happens? The early phase is supposed to occur 6 to 8 minutes. The late phase can occur 3 hours to 24 hours afterwards. So that's what you guys have to keep in mind when you're asking some of these questions. When you're doing a history, this is we're going to go on. You don't find a lot on just the physical exam when you see patients. So it's important to understand exercise-induced bronchospasm may occur after exercise, not during exercise. So you got to keep that in mind too. This just shows, again, 6 to 8 minutes, classic. You see that drop in FEV1 right here. Beautiful. Okay. make the diagnosis here kind of easy. Yeah, it looks easy if you have the equipment to do it. Okay. Again, it should really be anticipated. Anybody with asthma really has exercise-induced asthma. I mean, they really, exercise is definitely a triggering factor in this. It might be the only trigger for some people. And again, classic 5 to 10 minutes after stopping exercise behavior, and usually resolves in another 20, 30 minutes. But then again, you have to look for secondary phase. Okay, and again, it can occur anytime afterwards. Again, up to 24 hours. So just got to keep that in mind. This is another exercise provocation test, and again, just got to show you the same thing. 5 to 10 minutes after the ceasing activity, again, we can decrease the peak expiratory flow rate. Look at that. I love these bullets. Okay, interval sessions, aerobic exercise. Starts less than an hour after initial aerobic exercise, and lasts up to 3 hours. Refractory phase is what we're talking about. This is what, and we'll talk when we talk about treatment a little bit more after this. The refractory phase results in as little as 1/2 the degree of bronchospasms in the first episode. And I really don't know what that means, to tell you the truth. Occurrence is unpredictable and intermittent. That I know. That I know what that means. It definitely is. It's really difficult. And I'm going to tell you about a couple of cases that I had actually just in the office in the past 2 days. The warm-up period. This is really important. Warm-up period can be used in an attempt to ensure the competition occurs, during the refractory phase. And we'll get to, when I talk, we get to treatment. I'll talk about that a little bit more. A lot of times you don't have to use medications on all these people. Okay. And sometimes kids will react. It's kind of funny. Sometimes you get somebody preventable, their heart rate's going like crazy, and these are not the kind of kids don't want to do this right before they're exercising because their heart rate's going to go up enough. So there's other ways to do this, like we would try and take this. Okay, this is what I want to talk about, the late phase. It says 3 to 9 hours. They use in some literature, this say up to 24 hours afterwards. Okay, so kids are they can cough as long as 24 hours after the initial exercise challenge. The late phase, again, how much difference is this? It's usually what you're going to see is cough and shortness of breath. Those are the kids that'll wake up at night after they're, they'll have a track meet that day, they'll wake up in the middle of the night and they start coughing, okay? And maybe they didn't do so well in track meet that day. And you have to, consider too, what's the environment that day? Is it a high pollen count? Was it a humid day? Was it a cold day? What sport were they doing? Okay. And again, this response is much more common in children. It's more likely to occur if severe exercise bronchospasm is present. These are kids with the worst asthma. You're going to see this in. Okay. In the late phase response, usually less severe than the early response. And here's just some, emotions can do it for sure. I mean, I'm sure you've all seen that. Anybody who's dealt with asthma knows that emotions can be a trigger. So we get stress, crying, laughing, hyperventilating. You see a lot of kids, a lot of adolescent females do this. Apologies to all the adolescent females out there. I have 3 boys, so I wouldn't know. They can act like girls sometimes, let me tell you. So predominant theories, just a couple of these. These are, nobody really knows how this occurs. Nobody knows what happens with exercise-induced asthma. There's a couple. One is the heat loss hypothesis. You inspire your cool air, it dries you out. So now you get the chemical mediators come in, you get bronchoconstriction, bronchospasm. Okay, that's one theory. The other one is the water loss. So you get dry air, okay? And that's the same thing, chemical mediators, bronchospasm. So what happens now, why does the kid that's just swimming have problems with exercise-induced asthma? You're in a humid environment, it's moist, so you're not dry, you're not really, it's in a pool. So what happens there is occasionally what happens is they figure just above the pool, all the chemicals they put in those pools, there's gases across the pool, usually whatever they're using, chlorine or bromine, whatever it is. But those gases can actually cause a problem. So those kids are coming up when they're doing the butterflies, or they come up, they're stuffing all that stuff in. Those are the kind of kids that might have a problem with this type of stuff. So swimmers can definitely have problems with this too, okay? Especially the distances. And that's the one thing we should bring up. Usually you're going to see exercise-induced bronchospasm in kids that are doing long distance activities, okay? Not kids that are running the 100 meter dash, the kids that are running the quarter mile, the half mile, kids that are swimming the 500 meter stuff. And this is what I wanted to get to before. We want everybody, this day and age, we want everybody up and doing stuff, okay? And the last thing we want to do is have anybody, okay, I get tight when I do this, and I don't know if pediatricians out here, I know there's a couple of them. How many excuses I'm writing for people to stay at a gym class. And I don't do that anymore. I mean, I used to do that all the time. If I knew the kid, I could cut him some slack. But that's the worst thing you can do for him is to get him out of gym class. You want him in there. And I mean, I'm sure the school nurses around here, you must see, you got to laugh at half of these excuses. I mean, especially for swimming.
Oh, yes.